So you had a wonderful night last night. Apologies I couldn't be with you because of the prior engagement, which I couldn't cancel. But you were in good hands with them and all the rest and everything. So today, as you understand, we have this one lecture this morning, and then we will divide into 3 groups and we go straight to the lab. So we'll show you how to go. And I think everybody knows the groups. You know your group where you belong. Yeah. So we will have, you don't know? So for the workshop. If you are not going for the workshop, okay, so we will prepare 3 people who will take group 1, group 2, group 3 to their respective labs. So without further ado, I would like to, shall I continue to? Yeah, I would like to welcome Dr. Fredrick Mashili, who is the head of Department of Physiology at MUHAS. He had a trip, he will explain, but he is here today to be with us. Karibu, Dr. Mashili.
Good morning. Once again, I'm Dr. Fredrick Mashili. I was supposed to be with you from day 1. Apologies, I couldn't make it. I was supposed to attend another meeting that was happening at Osaka, but then I just had to attend my session and come back to join you in this, what I call it, a historic meeting, because it is happening for the first time in Tanzania. So I hope everything has gone well. I've been following up online. The first day, I followed up all the lectures, all the presentation, and I could see that everything went really well. And I hope you're having a good time with us. So today, I'm just going to talk about rather a concept, I should say, but something which we are trying to establish in a way, but also discussing part of the experience that I've had together with the group, and all the things that we are trying to, bring up together in advancing what we call physiological practice in Tanzania. And this is motivated by the healthcare gaps and also the gaps that we're seeing in sports performance. So I would like to start with my personal journey in physiology, and then I'll talk about the role of physiology in healthcare, and then a bit about physiologist's contribution when it comes to healthcare, and then specifically drill into the role of exercise physiology in preventive care, and then mention 2 real-life case examples. So this has a lot to do with my career journey or my academic journey, and I would like to talk a bit about that so that you can see where this concept comes from. So I graduated from the University of Dar es Salaam, a medical degree, and then I practiced as a general medical practitioner for about 2 years. And then I joined the university as assistant tutor in the Department of Physiology before I joined Karolinska Institute for my PhD studies. And I'm glad my supervisor, Professor Anna Cook, is here. I've always wanted her to come to Tanzania. So I'd like to thank all of you because you've made this possible. So I spent a lot of time at the Karolinska Institute, and basically what I was doing is what we call translational studies. So I was shadowed at the clinic, the clinical physiology clinic, but I was also shadowing at the community-based. In Sweden they have what they call family physician. So they see patients from a certain neighborhood. And then I was spending a lot of time in the lab working with muscle biopsy. So it's kind of living inside a muscle cell, where you do a lot of mechanistic studies and molecular studies. So you can see that I had this opportunity to get exposed to patients, get exposed to molecular mechanism, but also the community. And then after my PhD, with all that I gained at Karolinska Institute, when I was coming back home, I thought that I'm simply going to establish something, which turned out not to be true because of some of the challenges that everybody, I'm pretty sure you're facing, which I think will be part of the discussion. And then looking around, we are very much established in public health. So when you're looking around, trying not to lose what you've gained, you try to look for a lower hanging fruit. And this is how I joined the, I got a scholarship as a visiting scholar at the Harvard T.H. School of Public Health. And I was working on cardiovascular health. And what I was doing is to translate the basic science or physiological skills that I've acquired to the public. And I'm very much into exercise physiology. And what I was doing here is physical activity, which is much more of a population-based intervention, where you realize the effect of exercise in prevention and management of diseases. So, as a fellow from the Harvard School of Public Health, after being exposed to public health principles, I thought that I want to promote physical activity. And this was community-based physical activity. And one of the things that came into my mind was what we call the active commuting. And active commuting is walking and cycling. So I thought that when I come back home, I'm going to promote active commuting. That is cycling and walking. Make people walk so that they become active and they get prevented from getting non-communicable diseases. But then when I came back home, it was not that possible. You could see the roads, they're not safe for pedestrians, for cyclists. And now road safety became an issue. And most of the time people ask me, I have some students who are doing road safety, like what is the connection? Then I realized that if you want to make people active, if you want to make them walk and cycle, the roads have to be safe. So we have an area which is called the built environment. So the built environment has to be improved so that people can stay active. So there's a role of environment in that. So this is where the connection came by. And then slowly I went back into the a bit of physiological research, but mostly clinical research. And my interest was much more on body composition. And this comes from the fact that obesity drives a lot of non-communicable diseases. And then I was trying to look at the mechanisms or the effect of specifically body fat and adiposity in driving type 2 diabetes, but also cardiovascular risk factors. So now, this is the story behind what I'm going to talk about. But the other thing which we know very well is now we have what we call the changing disease panorama in Africa, for instance. Traditionally, we are much more into infectious diseases, and now we are seeing a surge in non-communicable diseases. This is mainly due to urbanization and lifestyle changes that are happening. And we know that these NCDs are very complex. So there's a genetic component, there's an environment component, there's a lifestyle component, meaning that a strategy to prevent and control them has to be multi-sectoral. You have to involve, a lot of facets, not just one. It's not straightforward. And of course, we also know that most of these diseases are chronic, so somebody has to be managed throughout their lifespan. So it needs a lot of different approaches when it comes to managing and controlling these diseases. Now, just to go back into some of the things that we know when it comes to NCDs or non-communicable diseases, we know that we do have risk factors like cigarette smoking and diet, physical inactivity, and these will cause obesity, dyslipidemia, hypertension, diabetes mellitus. And as physiologists, we know that there's altered body physiology. So this is the whole process from, somebody getting the risk factors impacting into their bodies, and then you have a lot of changes that happen within the body physiology. And from that, we know that there's a role for physiologists when it comes to intervening all these processes. Even though traditionally we usually wait for people to come to this stage where people are already sick or they already have complication, but if you look at the continuum, there's a role for physiological intervention. And this is where we think physiologists can actually play a crucial role. Now, this is one thing that I've met, well, it's something which is known, but I've really been trying to dissect and look deeper into this, what I call the physiological state spectrum, which is actually the transition from somebody who is fit, which is kind of supra-physiological state, to somebody who is sick. So if you look at the upper part of the spectrum, you have athletes, for example. These are people who are fit, and their body physiology is somewhat different. Most of their physiological mechanisms are different. And then you come down to what I call wellness. Usually a lot of people say healthy, but I think wellness is more than just being healthy, for the reason that I can describe later. So from being fit, you're well, if you do incorporate some other things, but you can also be healthy. But I think healthy is below wellness. There are more that need to be added for somebody to become well. And in all these, there are physiological changes that are happening. And then you move from being healthy to being sick, which you also have changes in body physiology. And from here, we now move into what we call pathophysiology. And then, of course, if we talk of somebody who has diabetes or hypertension, and then they get a stroke, for instance, and they're bedridden, there's a lot of physiological changes that happens when someone is bedridden. Now, if you look at this continuum, or what I call the physiological state spectrum, there's a role of physiologists in most of these, if you look at this continuum. For instance, bedridden people with stroke, sometimes they need to get back into normal state, and this is what we call rehabilitation. So there's a lot of things that can be done for them to kind of regain the body functions that they have that have been altered because of the disease that they have. But of course, the same happens to moving from being healthy to being sick. Prevention of diseases, this is what is there, and most of these are physiological interventions. You probably don't need any pharmacological intervention at this stage. And of course, moving from just being healthy to being well, there's a lot of physiological intervention which also needed here. And of course, for those of you who want to be athletic and super fit, there's also a lot of physiological intervention that needs to be there. So, walking through the spectrum, either preventing going this way or going back into being healthy, well, or fit, needs a lot of physiological intervention. And now, if you look at the physiological spectrum, you realize that there's a role of physiologists in really optimizing health. Now, we do have what we call physiologists, or medical doctors who are physiologists. And these are the people who, apart from going to medical school, they've dwelled deep into physiological mechanisms, be it molecular or whole body mechanisms. So they basically have a better understanding of cellular, tissue, system, and whole body physiology. They have a better understanding of physiological state spectrum, like the changes which is happening. As one is transitioning from being fit to being bedridden. They are also well positioned to understand when things start to go wrong, because this is where we tend to forget. We wait until when things are very wrong. But these are the people who can trace the physiological state spectrum and know what is really happening. And they're also licensed to work with patients, so they can intervene with patients. Now, talking of these are people who better understand body function. And of course, we know very well part of investigations is what we call physiological investigations. And this is where you can detect whether something is going wrong. And this is actually the role of physiologists when it comes to performing some of these, what we call physiological investigation. Some of them you're going to get training today. And here we talk about spirometry, which is part of the lung function test, part of respiratory physiology, which is a very important topic in physiology. We have EEG, which is part of neurophysiology, which you're going to get a workshop today. We also have ECG, and we have stress ECG, which there's application of cardiovascular physiology and exercise physiology principle. So these are some of the investigations that physiologists have a role to play when it comes to practice. Now, something which is extremely important nowadays is the role of exercise physiology in preventive care, but also athletic performance. And this has to do with the application of exercise physiology principles in prevention of chronic non-communicable diseases. There's a lot of programs that have to do with exercise prescription nowadays. So here we are talking about the role of energy expenditure and caloric balance in weight loss or weight control, which we know that this is very important when it comes to prevention and control of these diseases. The role of cardiopulmonary fitness in cardiovascular health, and the role of strength training for bone and muscle health, and also the effect of exercise on glucose uptake. All these are crucial and very important when it comes to prevention of lifestyle-related diseases. But of course, we also have application of exercise physiology principle for athletic performance and injury prevention. And here you have physiologists with better understanding of exercise types, intensity, duration, and their impact on performance. But also, they have a better understanding of the way the body interacts with performance enhancers. Nowadays, you have a lot of supplements and performance enhancers that will modify the body physiology. And physiologists have a better understanding of this, so they can play a role when it comes to improving athletic performance, which could be part of the physiology practice. Now, my experience when it comes to practicing physiology, which is quite new in our area, I know that in South Africa it's quite common, in some other places it's quite common, but in my country this is completely new. But I have worked with a physiologist practitioner, and one of the work that I've done, I've worked as a consultant in one of the consultant firm, wellness firm. And basically what this cooperative wellness firm was doing was just to do kind of health talks, what we call health talks. So in cooperative world, you talk about healthy diet, exercise, stress control, but there was not much that was being done. So I was just being invited to give a talk about exercise, maintaining physical well-being, mentality, and things like that. But it was very difficult to motivate people to adhere to healthy lifestyle. They will ask a lot of questions, they will be very much motivated. When you come back the next month, nobody has followed. So that was a challenge. But the second thing, it was very difficult to monitor their progress. So even if somebody tells you I've been doing it, you cannot really tell whether they've been doing it. And then there was another challenge. People needed one-to-one targeted and specific prescription. Like people, yes, you're talking with us as a group, but I probably need to get a more closer, personalized prescription. Now, based on this, we thought that we probably need to come up with something where we can incorporate these needs based on the gap that we've seen. And this was the evolution of what we call Daktari Wellness Consulting. Daktari means doctor. And this came because of a need to really motivate people to adhere to healthy lifestyle. Not just talking to people, get them paid for your talk, but you want them to also benefit from your talk. And there was a need to have more targeted one-to-one prescription because people are different. There was also a need to set measurable targets which you can use to monitor progress. So if day 0 you had so and so, then after 3 months I expect you to see this, and I can actually measure that. And also there was a need to incorporate health profile assessment in the program, like doing some of the measurements like body composition, blood pressure, heart rate, the things that you can actually measure and monitor. We needed to do that. and there was a need to incorporate research in that practice. So this is kind of a platform whereby you can trace what I call the physiological state spectrum. So if you have a cohort of people who are, within various stages of the spectrum, you can actually trace the improvement, and from there you can do a lot of research trying to investigate what are the things that are happening when somebody moves from one level of physiological state to the next level. And also, there was a need to incorporate athletic performance in the practice because of the experience that I'm going to share with you. Now, our main point here is what we call health profile assessment and physiological investigation. And this is where you can actually trace the physiological state spectrum by knowing the health profile based on physiological function. And the very common thing that we are doing right now is the body composition analysis, which can tell you when we talk about weight loss, we're not talking about weight loss, we are actually targeting fat loss. And you want to maintain your body water, and you want to maintain your muscle mass. Now, with technology, we have equipment that can tell us the proportion of your body which is muscles, water, or fat. So if you set a target, you know exactly what you want. But also, individuals have their own needs, they have their own targets. With this, you can actually trace that. But of course, we also have some other equipment, simple things like blood pressure, resting heart rate, which is a very good indicator for improving fitness, and so many other health profile measures that you can actually set in the baseline and use them to follow a person and then trace them down the physiological state spectrum. And this is also very good for targeted prescription, which was also one of the things that people wanted, because you know that the targeted prescription can be guided by the health profile assessment, because you've done the blood pressure, the heart rate, the body composition, and then you know the individual overall health. For instance, you're dealing with somebody with hypertensive, you know what will interact with probably antihypertensive when you're prescribing exercise or a certain diet. So having knowledge of that is very important when you're trying to prescribe that. But you also have personal preferences and targets. Some people don't want to lose too much fat, they want to keep some. So we also have to respect that. And based on these, you can actually monitor that and give tailored prescription. So the other thing which just came based on my experience at one time when I was working with a national basketball team, and they will come here for body composition analysis. And then I will talk to them, and I will realize that most of them have very low muscle mass. And when you talk to them, the kind of training that they're doing, they're only doing aerobic exercise, no strength training. And their nutrition, they eat everything which is available. So based on that, I thought that we need some kind of intervention when it comes to performance of our teams. And we thought that we need to incorporate ways to improve athletic performance based on our understanding of physiology, body physiology. So this was important, and it has to be part of the practice. Something which is not being done in our country, actually. I'm not sure about other countries in Africa, but for us, this is a huge game, and we definitely need that. So this also became part of the FAME, which we just established, like athletic performance should also be part of the practice that physiologists can do. And based on that, our next target is cardiopulmonary exercise testing. And this is very important in research, but also very important for athletes in assessing their fitness. But it is also very important when trying to predict diseases. And we are looking forward to, once we get the opportunity to acquire this equipment, to start performing some of these tests, which will be also very important part of the physiological practice. And the main goal is actually to form a cohort try to translate and understand the mechanisms and changes that are happening as one moves from being fit to having a disease, which I think a lot is known, but still a lot is not known. Given some ethnic variabilities, environmental issues, and so many other things, we still need to get deeper into understanding physiological state spectrum. Thank you very much.
Thank you very much, Dr. Mashili, for your outstanding journey to physiology and what you embarked to do finally. And we wish you well. I think you will be very successful in a show way in Tanzania, how you can incorporate physiology into practice. So if we have 2 or 3 questions to Dr. Mashili, 1, 2, 3, 4. So 4 questions. We don't have the mic, moving mic? No. Okay, just try and shout. Good job.
Are you really shocked? Thank you so much. It's very interesting. Insightful. I do think yesterday in this session was speaking about the future of physiology. I do think one of the most important things to focus on exercise physiology. I just speak to Dr. Marina. I told her that we are sport and professional athletes to the world. Something the countries have to invest on, not just for our wellness, which is important, but also for like huge income. They are professional athletes working all around the globe, in Europe, even in the world now. So I like so much your talk about the world. One question I come to speak that the top of being well is fitness and being athletes. But even professional training, we got problems. One of these we have like cardiac arrhythmias and so on. So how can we define this? Just because we know that the is to vigorous exercises, there's something for females, hormonal imbalance, for males that we don't have cardiac arrhythmias and even responsible. The second one.
Thank you so much for the good presentation. I'm really inspired by your career path. And something that also inspires me is the fact that you can apply physiology to everyday life. You can, that's really, it's really something I want to achieve in science, not just in the lab, at conferences or people to apply to the science. But something, I won't say on the lighter note, but most times we're always talking about how people who are overweight can do something. We're not talking about people like us who want to gain a little of weight. So we have plans for people like us who want to gain a little of weight.
Yeah, before I forget, yeah. So that's a very good question. I'm just working on a documentary, looking at some of the things that can go wrong in marathon runners, and one of the things is the issue with sudden death with footballers, but also marathon. It's quite a rare occurrence, but it occurs. And I've been going through a lot of papers on that, and there are 3 main causes. One is underlying heart disease, which is not known. Yes, that's number one. Number 2 is actually hyponatremia, because of taking too much water. When people are running, when people are doing marathons, they think they get hydration, but they actually end up drinking too much, and then they dilute their sodium, and they get exactly too much water. They don't get this, exactly. And then the third one is environmental changes, like when there's too much heat, and So one of the things that we are also trying to do, and again, the most important part of physiology practice is advocating on regular health check, like deep regular health check, especially to athletes, because some of these people have underlying diseases and they don't know. So when anything goes wrong, you end up getting a sudden death or something like that. So this is very important. It's also important for, marathons are very common in Africa. It's something which people run a lot, marathon. We haven't had any event in our country, but as much as they're becoming popular, you never know. So we want to educate people so that they intervene, so we don't see that, because if it happens once, it's going to break everything. So it's better for people to understand that. So those are the main causes, and I think again that pushed the importance of having the health check and the better understanding of physiology, so that these cannot happen. Especially we talked about the gender differences. All these are part of physiology, so you need somebody who really understands all those differences.
I suppose also what is the role of that the pressure ethics and stuff is about physiological cardiac, and then you have this cardiac. Could be this because of
For the hypertrophy that happens with the athletes, it's usually functional hypertrophy. And the reason why they get bradycardia is because their heart can pump a lot more blood at one point. Yeah, so usually that's an advantage. But with underlying diseases, because some of these have like congenital, problem with some molecular part of the cardiomyocytes, and then because they didn't know that, if they did a thorough health check before, they could have detected that. Yes. Yeah. So going back to your question about the when we talk about exercise for obese, if you look at what I've seen, I said weight management, and I say that because usually thin people think that they are not supposed to do exercise, but exercise has more benefits than just losing weight. Like I talked about cardiopulmonary fitness, which is very important for the heart, the health of your lungs and your cardiovascular system, but also, in fact, when it comes to weight gain, there are people who want to gain weight. Yeah, there's also a role of exercise. Resistance training is very important for somebody to gain weight. So it's about weight management and not weight loss. Of course, we like to use weight loss because it is selling more than weight management, but it's about weight management.
Okay, so there was this one, and then the last one.
Thank you so much for the presentation. It was really wonderful. Mine is basically an observation. A particular slide going, a slide that has the title Physician Physiologist Contribution. Yes, on that slide, there were words you used recurrently. Which may try to establish a disparity between the physicians and the co-physiologists. For instance, point one said a better understanding, that's to say physician physiologists have a better understanding of cellular tissue system and whole body physiology, which I tend to disagree with, and probably so, because this course may tend to establish disparity, operate superiority complex or inferiority complex between physiologists who are the medics and the ones who are not the medics. So in subsequent presentation, I think that should be English located. Thank you.
Okay, thank you. I understand what you mean. I was just trying to, I think at one point in time we had some discussions when it comes to patients. Actually, we are currently updating our curriculum, and one of the questions we were asked when we talked about incorporating this is, who is going to regulate these people? Like they're going to see patients, who is going to regulate? So this was not to discriminate, but I was just taking out that part. When it comes to patients now in places where they talk about they have to be regulated. That's why I say licensed. These are the ones who probably can see patients if there's that strict rules that who is going to regulate them. But it doesn't mean that these other physiologists cannot do that.
Yeah, thank you. I think it's a common debate, and maybe I would probably just put in a bit of weight to the Professor's presentation. as I mentioned to you yesterday, people ask me, what is a human carpenter doing teaching physiology? I told them aside. I think I would take his statement in the context that a physiologist physician vis-a-vis a physician, as opposed to a physiologist physician vis-a-vis a physiologist, where the other physiological knowledge, I told you, human carpenter. Most of my colleagues are using hammers and nails, right? And correct? I look at my patients because I must confess, I'm more of a surgeon than a physiologist. I do more of surgeons. I look at them from a physiological perspective. And I mentioned to you that when I'm operating, I'm restoring back physiology. And I was just looking at this presentation and I was quite impressed. And I was telling myself, maybe now I have an answer to them.
And I saw you taking a picture of that and there.
Maybe now I have an answer to them because now I'm replacing joints to be able to enhance the recovery back to health. And I also mentioned that I'm a spine surgeon and I'm operating on spines. I was just mentioning last week to Professor that a patient came who couldn't walk and he's only 40 and now he's back to restore function to be able to get that wellness. Right? So I was actually getting impressed. I was saying, now I have an answer to these guys. Because now I'm actually restoring, the entire is restoring their health medically, I'm restoring them surgically. But I think that that should be taken more in the context of the physiologist's additional knowledge to the physicians vis-a-vis the general physicians, as opposed to propelling this, maybe I should call it, I don't want to call it conflict, I think that's a strong terminology, because we also have that problem back in Kenya, and it's being fueled by, I think, negative energy. So I would say that that statement should be taken in that context as opposed to the physicians versus non-physician physiologists.
That's exactly what I meant. So if you put it really right, that's exactly it.
Thank you.
We need to remember that the workshop time has begun since 9:30. This is very interesting, I agree, but we have an exciting, but we have another responsibility. So let's agree 2 questions and then
Thank you, and thank you for your presentation. I'm Herbert from Calgary, our University in Uganda, and I'll start from where I can stop. When I'm teaching my students, I tell them physiology differentiates between the real physicians and those who are pretending to be physicians. And I tell the surgeons, because I also teach the surgeons, advanced physiology, and I tell them, if you are a surgeon who has no physiology, you're like a carpenter. Because you take that old thing of saying surgery is treatment using a hammer and you become like an explorer. Let's enter and see. Have abdominal problem, let's enter and see. You don't reason anything. But again, there is now this kind of discrimination. I think that's what we're trying to talk about. In Uganda, you have this thinking that if somebody is not a medical doctor, cannot teach medical physiology. Now, we need to see now, I don't want to have this kind of discrimination. If that's a pure physiologist, you are likely not to get a job in a medical school to teach medical students. And I think probably they read that your point. Okay? And we now interpret it the other way around. But me, I have both sides, and I believe, my professor of physiology, one time worked either in this university, but also in Tanzania, Professor Shaho Jonathan.
Shawi, he teaches us. Shawi was from Uganda.
Yes.
He was my physiologist.
Yeah, he told me in the UK, when he went there as a medical doctor, the pure physiologists teach the medical doctors, and the physicians who are physiologists teach the pure physiologists. So like, these ones give now the other side, the patient part of it, but this one give them the pure side, so that there is a balance. So I think, Daktari, you need, let's take this in the first meeting that are important. But a physician, I still believe that without physiology is simply pretending. And a surgeon without physiology is equivalent to a carpenter. The exercise part, now the real thing. I also have a training in public health, although leaning much more on research ethics. And we are not talking about exercise and non-communicable diseases, and then in Africa we have a double sword. Okay? We still have the communicable diseases, we also have non-communicable diseases that are coming up as an epidemic. And if we go to a village, say Tiglimano, Dar es Salaam, okay? You find we have both. Now, and I like that you went to weight management and weight loss and so on. You went to the village, you talk about exercise, really you're not telling them anything, because every time they are walking, they are digging, and what I'm promoting personally is, if you don't have the money to go to the gym, now you're from the city, okay? Go to your village, get a home, so that you do two things. You reduce malnutrition by growing food, and you also reduce your, or you also manage your body weight, and you also do kind of
Good morning. I'm a tutorial assistant in physiotherapy. My name is my question is basically on exercise physiology, whereby I see your content cover like 3 areas where you talk about exercise and fitness, and also the part where you talk about nutrition. So my question is, do you think it's proper to incorporate other medical professionals like physiotherapists and nutritionists to work with the exercise? Yeah.
So you need to stay there. And raise your voice. How Yes. Now we will solve the problem.
So I was saying that his presentation on exercise physiology had incorporated 3 fields. There was exercise, there was the physiology, and then there was the nutritional part. So my question is, do you think that it's important to incorporate other medical professionals like the nutritionists and the physiotherapists to work with the exercise physiologists in order to ensure that there is proper health provision for the patients, instead of just focusing on the exercise physiologists?
Okay, yeah, thank you. So I want to respond, not to respond, to comment on what my friend from Kabale said about going back to the farm and, doing some money work. A few weeks ago, we are launching the Tanzania guideline on physical activity and sedentary behavior. And we'll talk about, the types of exercise that people are supposed to do. And we get that question like, are you going to recommend exercise to people who are, digging for like 8 hours in the villages? And we say yes. And the thing is, you have to balance between the 3 types of exercise. You have strength training, you have aerobic, and you have flexibility, which I think is very important. These people are just, using a hoe on one side daily, so they need to do a bit of stretch-up, which is also part of exercise. So this is something that we tend to forget. So again, as I'm saying, exercise is usually regarded as something which everybody knows, but it's not true, because there are certain things that people just overlook. For instance, when we talk about prescribing exercise, you need to also think about the flexibility exercise, which farmers need to do that in village. Otherwise, they will come with back pain and joint pain. Responding to what the physiotherapists are concerned, I think what you said is exactly true, and this is what we're trying to do. Like physiotherapist, occupational nutritionist, also you have to be part of it. And for the curriculum that we're revising right now, which is at MSc, we also need physiotherapists to be part of that. So it's MSc medical and exercise physiology, and all these people should be part of the team. So exercise physiology will take all these different people, and then it incorporates this different knowledge into either caring for patients or improving athletic performance.
Thank you very much. Let's give Dr. Mashili and ourselves a big round of applause.